So we're here, we're live, and sorry about the little technicalities. There was a lot of traffic on the freeway coming here, and I got stuck in it.
Yeah. Me too.
So Dave is the guy with all the questions. So I guess he's here. We can start. He can ask away. Kind of.
So you guys, is the energy good?
Energy's good.
Are we?
We're awake.
Is this room glowing tonight, or?
It is glowing.
It seems to be. The fluorescent lights are.
I do feel like I'm always a little brighter, though. Is it just because it's reflecting off my head, or what?
I think you're right under. Do you want to switch?
No.
Okay.
Fluorescent lighting.
I just, this way I only look one way, and I can see both of you
Yeah,
guys this
that's
way. So
true.
before I
Yeah.
was between you, so.
Yeah.
Not anymore.
It was funny. I was thinking I haven't had a chance to be in the middle. Maybe I should be in the middle, and I ended up in the middle tonight anyway. See how energy works?
She wishes
Just-
into her
Just think it, and there it is.
universe.
So I saw a really cool, we were talking about movies last time.
Yeah,
Have you seen Doctor Strange?
I have not.
I've heard about it, but I have not seen it.
Made me think of, you got to see Doctor Strange,
Okay.
because it's a lot about chakra and energy and
Oh, wow.
yeah, that's his deal. I don't know. I mean, I was a kind of a comic geek, so it was interesting. He actually heals himself for the energy, and he goes to the other dimension. So that was one of the things that I actually questioned that I came out was, is energy like a different dimension? Is that, can you look at it that way, or is that, I don't know, you don't have the framework or the background, I guess, of Doctor Strange, that whole.
No.
But-
I've got my head wrapped around the idea, but yeah. Do you want to start, or do you have any ideas?
Well, I do. I think there's different dimensions.
I know it's kind of
for
random.
Sure.
I mean,
No,
these are
it's
super questions. I mean, it's just, it's kind of a free flow, but as I think about things, and I know that when you have other people, they're drawing, we talked a little bit about God and then you see movies like this, and obviously they're based on somebody's perception of reality, or, and it's interesting to me, like even when I watched that movie, that I thought of you guys. I thought of some of the things, and the fact that he, without giving it all away, he's in a car wreck, and he's a surgeon, and his hands are all injured, and his life is over and everything, and the whole process but his mind is really good, and his spirit is strong, and he's got a lot of energy, so to speak. I mean, in the whole process. So it's just really kind of interesting in how.
Yeah. You can think of it that way. So in the 3D world, I can't necessarily touch you from across the room, right? But if I am trying to connect with you, you can look at it as I have to go into a separate dimension and connect with you on the energetic level at the energy. So you can absolutely think of it that way. That
Well, there was a lot of that kind of
Yes.
stuff going on in this movie too. A lot of
Yes.
things where they weren't physically present. Actually, he literally left his physical body,
right.
and it was like the the spirit, or his soul, or whatever they were even battling, and just other things.
Yeah, it is. It very much is. A lot of energy work doesn't happen inside of our bodies. You feel the effect of it on your physical body, but it doesn't happen in. So when I'm doing those things, I'm not really in the room where I'm sitting. I'm sitting in a room, but I'm not really in that room. So if somebody walks in and tries to have a conversation with me, it's not going to work out well for them.
Yeah. Interesting. So it kind of is, there is some, well, yeah, if you get to see that movie, I'd be interested in any parallels or connections, or if there's anything there that looks like that, because I thought it was very entertaining, but also there seemed to be some of the whole energy process, or thought process, or whatever, reality or whatever behind it.
Yep.
So.
Yeah, I will definitely have to check that out. Someone just walked in the room. This has just been a fun show so far.
So anyway, so I think the first time we got together, we kind of talked about just kind of what energy was, and you kind of helped me through kind of a little bit of that, just understanding, is it, something. And then I think last time we started to get into the whole energy work thing, and I think we just kind of got to a point where, I was trying to get my mind around, this thing of you can see and, scan and the process and everything. But I think where we got to was kind of a place where I knew it was going to either take a really long time from there,
Right.
or I was just going to get more confused. So I think that's kind of where I left off was, and it gave me a lot to think about. One of the things that I wanted to, I guess, a place to start that I thought about is, okay, so what types of stuff, okay, or what kinds of things do you people normally?
You people.
The weirdos. You weirdos. What
People-
kind of stuff do you play with?
No, what kind of stuff do people normally come to an energist for? I mean, obviously, I say obviously, I'm assuming that if I said, I can do that, or a lot of different things, because it sounds like energy is part of everything to some one respect. But when you find people coming and looking for things that you can help them with, what would be the normal, or what would be the most common thing? Yeah, that's a good word. Yeah, common thing that people would come to you for.
So energy work is a lot about releasing blocks. That's a conversation in itself. But a block can manifest in any way from PTSD. It can manifest as diseases. It can manifest as
Depression.
psychological trauma, all sorts of mood swings. So it really varies. It can touch a huge gamut. I worked on a guy who had trauma to his knee, and he couldn't bend it, and after one session he was able to bend his knee and actually put weight on it. I've worked with cancer patients. I worked with a lady who couldn't be around markers, permanent markers. She could not be in the vicinity of permanent markers, and it was because there was formaldehyde in there, and she had traumatic memories as a child with formaldehyde, which she didn't know. All she knew was she could not be around the permanent markers. And after about an hour's worth of work, she was able to just sniff them. Yeah. I don't know if she got high that night or not, but it was just, yeah. But she was actually able to sit next to them and actually hold them up to her nose without a problem. So blocks will manifest in a lot of different ways.
So let me give an example. So I feel like I'm getting a cold. You ever get that feeling that, it's like the really early stage? Is that something that people say, okay, is that stuff you work on? Because you did the bone thing. You told me about the bone coming out. And looking at, is that stuff that you?
Yes. So you can work on that. Generally, people who will come to me or somebody who does what I do, it'll be for larger things. A cold you can usually get rid of in a few days, and you might be able to get rid of it yourself depending on how you think about it. But if you have a physical condition where the doctors are not helping, there are a lot of things that doctors will tell you cannot be healed. Because according to Western medicine, what you do is you put a Band-Aid over it and hide the symptoms and hope that the patient keeps paying you long enough before they die. That's just generally how it works. So there are a lot of situations where either the doctor tells you you can't be healed, or what the doctors are prescribing for you is not working. And so they're looking, it tends to be things that are bigger. Somebody with massive emotional problems, anxiety attacks. For students, test anxiety. A lot of the bigger tests, the SATs, the ACTs, the GREs, the GMATs, whatever, or if it happens to be a critical test where if they're going to fail this test, then they won't make it, and then anxiety pops up. So they tend to be things on a larger scale that aren't easily handled on their own, one way or another.
So what I'm hearing is, and I'm just trying to kind of, so what I'm hearing you say is a lot of times there are emotionally based types of things that are pretty common that people, that are kind of recurring or chronic in terms of emotional, maybe emotionally based. Also things where people have exhausted the more traditional medicine or means to resolve.
Right. Or they just understand that the traditional methods should be the last resort and not the first resort.
Okay, but I mean, does that?
So, yes.
So when you engage somebody that is new, okay, so for example, at being, you know, an executive or being kind of in a more traditional mindset, you know, I'm probably, at least until I have experience,
Sure.
right? I'm probably not going to go to an energist
Right.
as my first resort. Is that
Yeah. So a lot of those
normal
people.
or typical?
Yes.
I
And
would,
so
I mean, that's what I would think. But I'm just asking, because I mean, I don't know who all you
right.
serve or whatever.
And so a lot of those people would come to someone like me for stress, too much stress, high blood pressure. They can't calm down. Do we have a question?
No, it's just.
Okay.
Okay.
They can't calm down. They're overly stressed. They're noticing they're getting headaches during the day. They're not able to focus properly. So for them, the first experience might be just relaxation, the blood pressure dropping a little bit during the day.
Okay.
And then you have a couple sessions of them just being able to relax and getting into a place that they wouldn't be able to otherwise, unless they're self-medicating or otherwise medicating, right? So people who are on Xanax or go home and just have to have a drink because their day is constantly that stressful, they might start there. Where let's get your system under control so that's not happening on a daily basis.
Yep.
And then from there, what they'll start to notice is their health begins to improve without them doing anything else necessarily.
So if a patient or a client, what do you call them, patients or clients?
Yes, the American Medical Association forbids me from calling them patients without getting sued. Therefore, everyone I work with is a client, regardless of what we're working on.
Well, that's actually a good thing because working with the healthcare industry, my belief is the best outcome for any consumer is to never become a patient.
Exactly. And that's my best outcome too. I don't believe that someone should have to come to me for the rest of their lives in order to fix one problem. Now, there are various problems that may come up, or if they are in a high stress job, then we can work on a regular basis about reducing the stress. But as far as a physical problem, no one should be coming to me for the rest of their lives or for years at a time to fix that one problem.
So it's kind of once you deal with kind of a current complaint or need or whatever, then
it's fixed, the problem's done.
So is it only fixing a problem, or is there a maintenance kind of relationship that you would have with somebody from an energy
I think there's a
standpoint?
maintenance relationship with yourself and with that person.
Well, I mean, again,
I think it
if
depends.
I'm not an energist,
Right.
and I have an energist that helps me to align things or get my energy sourced well, or am I using
Sure.
decent terms?
Sure.
I mean, I don't know
Yeah.
if they're proper from your, but.
There are no proper, you can call it a thingamabob, and I'm
Okay,
okay
all
with
right,
it.
so if I get, if I'm dealing with a current complaint or current
Right.
issue, is there a maintenance or preventative
Yes.
thing that you can do with somebody to say, okay,
Now
you
you're,
know,
now we've
now
cleaned you
you're
up.
okay, and here's things you're doing, but then we all get out of control ourselves to some degree, right? So
Yeah.
how do you help people stay on track?
Yeah. So think of it like chiropractic or massage.
Well, that's my framework. I
Right.
I do get a regular massage, and I do do
Right.
regular chiropractic, but I'm in what they would term as maintenance.
Correct. So initially, when you go to that practitioner, they are going to fix the problem.
Right.
And it's going to be a fairly constant schedule until the problem is resolved.
Right.
And then to make sure the problem doesn't come back, then you have regular maintenance. You can.
Yeah. So is that kind of like on a schedule basis, or is it like, okay, I feel like my energy is waning here, or what? I mean, again, I'm not being
Yeah.
facetious there or anything. I'm saying that, you know, like with my chiropractic, with my massage, I kind of have a regular, every couple of weeks I go in and get a massage, whether I need it or not. You know, I mean, just to, but, you know, in the chiropractic, I tend to go, I'm starting to feel that things aren't quite aligned right, or I'm starting to feel not fully symptomatic, but like something's, you know, I need to go in. So sometimes it's maybe every couple weeks, sometimes once a month, sometimes it's,
Right.
is that, do you help people have that level of sensitivity to their energy?
Yes, and I think it's also learning how to be more aware of your own energy so that you know when to ask for help. You know, if you're not, like for me, I meditate twice a day. That's the thing that I have to do, and I'm really off if I don't do my meditation. So I think if you're starting to meditate and be quiet within yourself, you'll notice things that may not feel right, or then you could call somebody like Kern and say, hey, this doesn't feel right. Like, what do we do? There's nothing on there.
Okay. Sorry, I'm checking out the laptop to see if there are
I've been
any,
watching it.
see if there are any questions. Yeah, so it is, and just like with massage and chiropractic, the more you stay on top of it, the less you're going to have the, oh my God, I can't believe that just happened.
It's like, or if you're at
Yeah.
home and you're stretching
Right.
and you're, you know, exercising, you're less likely to maybe need to go to the chiropractor and the
Right.
massage therapist because you're
Right.
doing things to take care of yourself. So I think it's a good mix of both.
Mm-hmm.
So that's a good point. So some form of meditation, relaxation, internal focus, is that a thing?
Yeah.
I mean, is that something that to manage your own energy or whatever, is that something that somebody would do?
Yeah.
Yes, absolutely.
Mhm.
Um,
Do you want to go?
So with that, what people start noticing is if they do develop a regular practice of meditation, they will start noticing weird stuff comes up for them. And the weird stuff that comes up, it could be negative emotions, it could just be weird things that start happening. Those are energy blocks.
Yeah.
That now that your body's relaxed and it's got a chance to kind of get normalized, your body goes, oh, well, we've got this thing that we can get rid of too, and we've got this thing that we can get rid of too, and so it'll start popping those things up to the surface to be released. At which point, can you get rid of it yourself, or do you need somebody else's help?
Yeah. So you'll start to see certain thought patterns coming up, triggers that may come up within you, emotions, or you may notice certain discomforts. You know, if you're sitting there for a while, you may notice, that's interesting that my left hip hurts all the time. Why is that? You know, and so
Where it never was a thing before.
because you just were.
Well, it's actually my
constantly
right
active.
hip
Oh,
right
wow.
now, but.
I'm
are you
not like
sensing
her,
this?
so
Is it-
I can
or
only
did
get
you-
hip
oh.
so far.
It's like, maybe it's a hip,
Maybe it's
maybe
an
it's
arm.
a chair joint, I'm not really
Not
sure.
really sure.
It's like,
There's something wrong with this guy, but I don't, I can tell that he's just not quite right.
Right.
I haven't narrowed it
Yeah.
down to a
it was
specific
the
body
traffic,
part.
it was the traffic.
Yeah.
I think the biggest thing though is learning how to calm down, right? Because with our environment, we've got this little box that we carry around all the time and it goes off pretty regularly for me. I know I get a fair amount of text messages through the day, and there's the TV and there's Facebook and there's all this stuff that's kind of going around you. But if you can step back from all that and just stop and figure out what's going on with Dave today, how am I feeling? Most people don't do that. Most people are not introspective. They would much rather just shove it down and not deal with stuff, and you know, like Karen said, cover it up. You know, take something that will make me feel better, or you know, hang out with somebody. Keep moving. Don't stop, because the moment we stop, then we might feel something we don't want to.
You might have to deal with an issue that
Rather
you've
not.
suppressed.
And so then what happens is then suppress, and then who do you need?
Right.
Because then now it's become this bigger issue within inside of you, and you don't know how to get rid of that on your own. You need somebody to help you walk yourself through that, whether it's walking through the emotion or the mindset of something, or dealing with it
In a healthy, non-drugged way.
Right.
Yeah, in a healthy, non-drugged way that actually has an end point.
Yeah.
Not that
Right.
there are certain types of practitioners out there. I won't label them, but they will have you coming back for years and years and years working on the same problem.
Right.
Which means all they're doing is collecting a check. They're not actually fixing your problem.
Right, and releasing it.
So, yeah.
So it's more maintaining an illness rather than, or
Exactly.
a level of illness rather than resolving it.
Yeah.
Well, it's the Western medicine approach to let's band-aid your symptom and hope that it stays covered, and then if it doesn't, we'll give you a pill, and then we'll give you another pill, and then we'll have you come in every week and just keep giving you pills. And this pill isn't working, so we'll swap it out.
Right. So who knows how many things could have already been healed or
Right.
no longer needed, but the pharmacist isn't going to give that to us, right?
And neither will the doctor, because their
They need to
paycheck
get
goes
paid.
away.
Interesting.
So that's where all the energy healing and the homeopathy and the naturopathy and all of those modalities, if you find somebody who's actually good that you can trust, then you're working with someone whose best interest it's in to get you well and keep you well.
A lot of stuff is avoidable. I was reading a study about sugar, and they're really putting sugar in with, is it causing things like ADHD? Is it causing anger within people? And then is that causing crime? Because where do you see a large bulk of sugar? Well, it tends to be in lower populated areas because they don't have access to grocery stores. So it could be the stuff that you're just ingesting, not to mention any emotional stuff that you're holding down or the thoughts that you're having.
ADHD is a whole,
A
we
whole
could have a
nother-
whole show on
nother,
that.
But I was just
and,
talking about this
yeah,
particular article.
And
so.
that's more of an addiction than a food
Right.
thing. But yeah, so that's.
So ADHD is something or ADD, and I actually was just talking about that now since you brought it up in terms of, so when you say that's, you know, they give kids like Ritalin and
Crack. They give them crack.
yeah, it's
Yeah,
an
that's what it is.
amphetamine. I mean, I have ADD, and actually I self-medicated with caffeine for a lot of years. I mean, drank so much caffeine I actually overdosed on caffeine because caffeine actually allowed me to focus and help me. So it's a low on the scale of drugs that you give for ADD. It's way at the bottom. It's not as
Until you overdose, and then it's right up there with crack.
Right. So is that, so that's something that there's an energy component or thing to deal with, or is that environmental?
So,
Go ahead.
so I would say 95% of ADD, ADHD cases are not ADD, ADHD. The symptoms of ADD and ADHD closely mirror those of addiction. It's a frontal lobe, addiction is a frontal lobe disorder. And the symptoms of addictions are very closely mirrored. So I think a lot of people, a very large majority of the people who have ADD, ADHD are actually just addicts, technology addicts. And it goes all the way down to children who are constantly playing video games and on their phone. And if you have to have your phone on constantly and you're constantly checking it, and you walk room to room in your apartment and your phone is in your hand and your phone sits next to you on your nightstand as an adult, and the first thing you do when you wake up is check your phone to see what's going on, you're an addict. You don't have ADD, ADHD, you're an addict. People today, we were talking about the millennials last Friday, they're not multitasking better. They are not better multitaskers. If they were better multitaskers, they would not be getting into car accidents while texting. What they are is highly distracted and highly distractible. So we've got a society full of highly distracted, distractible, addicted people who are being told they have ADD, ADHD. Now, there are a few people that do suffer from the actual condition, but yes, on an energetic level, most people can cure their own ADD, ADHD by turning off the TV, by turning off the video games, by muting everything on their cell phone except for the ringtone. Because most people have a Pavlovian response to their cell phones. So, that little ding goes off. They, God forbid, they let it sit for 10 minutes until they get where they're going. They have to pick it up in the car and they have to respond right then. They can't leave it in the next room. They can't turn it off. So a lot of that is just addiction based. It's not diet. It's not society. It's a frontal lobe disorder that can be easily remedied within a couple weeks.
Now, see, I have a problem with a squirrel would have run by there.
Sure.
Even if we were talking.
Well, no, you're one of the 5%, right?
Yeah.
But we've determined that there's so many things wrong with you.
Yeah, that's
just
That's why I'm here. I'm looking for free help. Is why I'm here.
And that's what we're here for.
Absolutely.
So if I come in and so again, back to the kind of the concept of energy work. So I normally would come in with some form of complaint, some kind of thing that's bothering me or whatever. What if I came in and said, well, I think I'm okay, but nobody's 100%.
Yeah.
And what could you do for me? What would you do? Would you say, okay, you don't have a complaint, so come back and see me when you got a complaint?
No,
Or would you say, okay, I can take you to the next level, or I can help? You understand what I'm saying?
Yeah. So we can, what I would do is kind of scan you and see if there are any problems that you should know about. Otherwise, it would be kind of like walking into a massage therapist and saying, my muscles aren't sore, but see what you can do. And then you get a nice little session. Something might come up during the session, something might not. But if you're generally in a good place and you want to maintain that, then we can talk about how do you maintain. What about you?
Yeah, I think that's true. I mean, and I think people don't necessarily know what's underneath the surface until they have somebody third party to kind of help them dig through it, right? I mean, if I started asking you different questions, then all of a sudden you may see the same emotions coming up over and over again. Maybe it is a constant emotion of sadness. You just really weren't aware of it because maybe you're numb to the situation.
Yeah.
Well, we come up with I know even myself, you tend to, you have a level of, let's say, discomfort or pain, maybe, again, like my left hip is actually muscle, I don't know if it's muscle or what, but it's was bothering me when I was working out today. And it was like, okay, is my hip going bad? Is this or that? And,
transplant.
But I'm not. But you kind of say, okay, well, I guess my age or whatever, I guess that's something I've got to live with, and you just kind of, that becomes the norm, and you just kind of deal with it, and maybe you deal with it with a painkiller, or you deal with it with something else, but you're able to kind of scan and see.
Yeah, and you shouldn't have to deal with it. There's no reason you should have to deal with it.
But what if I've come in and I'm kind of, like you said, I'm kind of numb to the situation, right? I'm kind of.
You won't be by the time we're done. You won't be by the time we're done. If there actually is something, yes.
Oh, no.
And you'll enjoy it. Yeah, but sometimes pain. Well, in your first session when we did that little mini session on you at Starbucks, that you started feeling pain. But you started feeling, pain, discomfort. You know the level of it. But it was in areas.
It was when I keeled over that you. No, I didn't keel over.
No, he actually did. It was really funny. We called the ambulance. But it was clear that you were feeling discomfort. But it was probably because there was something there that hadn't been worked on, and it was all in areas where you did have something, whether it was previous or not. So once I start working on someone, if there is something there, it pops up. It doesn't just kind of stay hidden unless, like we talked about last week, they really are not allowing the work to happen, in which case nothing will happen.
Right.
And that'll be clear within 20 minutes.
Do you find that, I mean, I think that in some people's case, the prospects of finding something I'm not aware of is intimidating.
Mhm.
Because a lot of people don't go to the doctor because they don't want to know.
Oh,
Right.
yeah.
To a regular doctor,
that's
right?
most
Right.
of the
I'd say
world.
most people are like, okay, if I've got cancer, I really don't want to know it.
Well, I also think that's
But
because.
then we're trying to keep people, early detection, knowing, or dealing with it's better than just ignoring it before it gets so bad you can't fix it.
Well, I also think that's because chemotherapy actually kills you. That's what it does. It's not killing the cancer, it's killing you. And the doctors hope that maybe
Kills
the cancer dies.
cancer faster than it kills
Maybe,
you.
yeah. So that's why people don't want to go to the doctor to find out there's something wrong, because they know, even if they don't know consciously, they know on an internal level that the doctor is not going to cure them. At best, it'll be you have X amount of time to live, but we are not going to cure you. Whereas when they come to someone holistic, our goal is to cure you. It's not to say you have this and you will never recover. It's to say you have this and there is a very good probability that it will be fixed. Now, it might not be fixed today, but it will be fixed. It's rare that something does not get fixed one way or another when you go holistically. The only times I've heard of where it really didn't get cleared is because it was so far progressed that their body didn't have a chance to heal itself. Because what we're doing is helping you heal your body, helping your body heal itself. We're not masking the symptoms and hoping something dies before you do. We're actually helping your body heal itself, but your body needs time to heal itself. And if you've run out of time because you refuse to look for something, then your body doesn't have a chance. What do you think?
No, I would definitely agree with that. And I think also from, even an emotional standpoint, which is more kind of what I've been diving into, is somebody so far gone depressed wise, not that they can't ever come back from that, they just may not choose to because they're just so far gone.
Yeah. So then it's a choice on their end. Are they willing to do it, and is there enough time left?
Yeah.
So and this again, kind of back to when you say somebody allows something, is that a lack of faith?
It could be. I think it's more of free will. We all have our own free will. We choose the life that we want. And some people, they choose a life of not knowing or being in anger or being in sadness. They're okay with what they're at, and that's perfectly okay. But I think it's choosing to want to heal. I mean,
well, there are certain circumstances where people benefit greatly from not healing.
Yeah.
So
Help me with that. So what does that mean?
So there have been cases where let's take a woman or a man. Gender is irrelevant here. Because I'm a girl, we'll go with the girl. So you've got
I like
woman,
that better anyway. Pick on yourself.
Yeah, I'll pick on myself. I'm okay with that. So you've got a woman who's married to a guy who's constantly working. He never has time for her. She feels neglected. She feels depressed. All of a sudden, she gets sick. And she gets so sick that he has to take time off work. And now he's home all the time and he's paying attention to her, and she's getting what she needed out of the relationship because of the sickness. If she heals, he goes right back to work and starts neglecting her again.
At least that's her perception of
Well,
what would happen or experience.
And there have been cases where it was a woman who, as soon as she got better, her husband went right back to work. And so again, she was neglected, remanifested the disease. Because there are definitely cases where someone is benefiting greatly from not being well, in which case there's nothing you can do, because getting well will cause the problem, will bring back the problem.
But is that that's subconscious,
It's
or
subconscious.
it's below the surface kind of?
That's all subconscious. Now, if you can get to the root of that and fix it on all levels, then yes, they can heal. But until the original problem gets solved, it's much better to live with cancer knowing you're dying, having your husband there taking care of you, than to be completely healthy, neglected, and lonely
For that person.
for that person. Right. So free will absolutely comes in, and you have to look at the whole. If something isn't being fixed, why? Because there's always a logical reason.
So that kind of correlates a little bit to, in the medical community, you talk about compliance. Because compliance means that, you know, you prescribe something, but they choose not to take the medication.
Right.
I'm not commenting on medication, but I'm just saying
Right,
that
right.
one of the biggest challenges for getting somebody well, even in a Western medicine world, is that the patient doesn't actually, they get the diagnosis and they get the solution, and let's say, assume it is, or it could make them better. It could, you know, the antibiotic could kill the infection.
Right.
They don't take it, or they don't take it as prescribed.
Right.
They choose not to, because you can't make them. So you're saying it's the same thing here. Is you can say, here's what I'm seeing, assuming I let you see it. I can actually mask the MRI, right?
Sure. You're in control.
Yeah.
Yep. And
Or I might be able to see it, but you can say no.
Yep. And
That's not there.
Or reverse, you could say yes, and then you get to decide to the level of things that you want.
Yep.
Right? Because it's the amount of work that you're going to put into your own journey that you're going to get back. You know, so if you're like, okay, I'll have you work on me once, but then you don't do the self-maintenance, you don't learn how to meditate or become aware of your thoughts or become aware of your emotions, and then you don't see her until maybe next year, your energy blockage is only going to go so far. Or you could do it a different way where you're like, you know what, I'm going to take this serious, and maybe like go into the doctor, I'm going to take this situation very seriously, I'm going to do exactly what they prescribe, and you would have a faster result.
Yeah.
Or you would have a result.
result. Yes.
Yeah.
I mean, the time's kind of irrelevant, so.
Yeah. Like for me, one session is really somebody who needs some kind of maintenance. If you're coming to me with a bigger problem, I won't take a client with a bigger problem if all they want is one session. Because I don't do dog and pony shows, and you would be throwing away your money.
Yeah. Same thing with me.
Yeah.
Yeah, to dig through your emotions, you can't do that once.
Right.
It's got to be a continual going through your emotions, going through your thoughts, having that person ask you the tough questions, and then you dig in through yourself and self-discover. Hey, yeah, you're right. This is what I'm learning about, you know, my patterns and my triggers, and then somebody else to kind of say, well, have you thought about it this way, to break through that. So I mean, it can't just be one session and boom, we're done. It's a constant journey.
Right.
So is it? Yeah, I think I get that. So it's basically something where you have to come into it assuming it is a journey,
Right.
and not just an event.
Right.
Is that
It's a marathon.
An event, the only purpose for an event is because you want to have the experience to know that there's actually something happening. But you don't go in asking to cure. Even if you were going in for chemotherapy, no doctor would look at you and say, yeah, take this one pill and you're done. You can't.
Okay.
It doesn't work that way. It took time to create this problem. It's going to take time to undo the problem.
So what if I don't? Let's say, yeah. So if I come in, you know, and somebody comes in and says, okay, I hear what you're saying. Somebody told me they got benefit out of this, and I got some things wrong with me, I think, but I don't know, and I'm going to give it a whirl. So, but I kind of don't really, I'm still skeptical. How much, what do I have to do to block it? Do you understand what I'm saying? In other words, you know, it's kind of like in the Bible, you know, he says, I believe, but help me in my unbelief. Or if you believe with a grain of a mustard seed, then all things are, you know, whatever.
Faith the size of a mustard seed, I can move mountains.
I can move mountains, right? So I mean, you know, so at least in a biblical sense, that's not necessarily a lot is required if you put your faith in the right direction, okay, or you're channeling it properly. So what, in the case of energy, I mean, do I have to be totally surrendered or totally a believer, if you're a true believer, or do I have to be, what's required there?
So
So that
when
I'm not blocking.
so when we first met and talked about,
Right.
you remember that meeting? Where were you level as far as belief level?
I honestly thought the same thing. I still kind of,
That it's
that's
right.
kind of like BS, you know, that I mean, or, you know, not really, you know what I'm saying?
Yeah,
I'm always curious
Mm-hmm.
and interested and always looking to take things to the next level. So I'm not like totally cynical with things to the point of, hey, I wouldn't even
Right.
open my mind to that possibility.
Right.
You with me? But
And within 5
everything that I
minutes-
had, yeah.
Yeah, and within 5 minutes, you were having a very clear experience.
Yeah, I mean, to be honest, I kind of remember it. I mean, I remember a little bit of it, but, you know, and what it was, and I remember that. But yeah, I remember having,
It was a clear experience.
Yeah.
What, one way or the other, there was no disputing that
Right.
you were having an experience.
right,
And then it wasn't something that you were manufacturing in your mind, because I didn't tell you what you should be expecting. I didn't give you any
Right.
pretext or context around it. I just said, let me give you a sample.
Mhm.
So it's a very clear experience when someone has one.
Is it the same, or is it different for other people?
It's different.
It's different.
It's different for everybody.
Really?
Yeah.
Everybody's life is different. and
Sure.
Personalities and journey, so no, it has to be
So
different.
how the experience, how you would recognize something was happening would be totally different from one person
Mm-hmm.
to the next.
Yep.
But they would know.
Yeah.
Yep.
Well, clearly something would be happening that wasn't happening before you started. And for people who I'm doing mini sessions on, just so they can kind of have an experience, or first timers, I ask them to walk me through what they're feeling. So it's not just me in my head. I'm actually making them verbally acknowledge to themselves that something's happening, and this is what's happening, and now I'm feeling this, and now I'm feeling that.
Okay. So you're actually walking them through.
Mm-hmm. The first time. Afterwards, maybe not, depending on what kind of modality we're using. But the first time, they not only do they have to have an experience, but they have to acknowledge the experience for themselves. And I make them acknowledge the experience for themselves, so that they can't walk away saying nothing happened. And I make them do that without any context. I don't say this is going to happen, and then this is going to happen, and then this is going to happen. So whatever is happening, it's not because I put it in their head that would be happening. It's because it's actually happening.
Okay. So you've used, how much time have we taken?
We've been on 45 minutes. It's usually right where we're about
We couldn't possibly have been on 45 minutes.
since 1915.
Oh, yeah.
Oh, have we really?
Yeah.
Wow.
I was serious.
Wow.
I thought you were joking, but
I'm
yeah.
serious.
Well, I kind of felt, because I was actually going to launch into the whole thing about modalities, and when you said different modalities. And
Ooh,
there's
that's
different
another
things.
show.
Yeah.
And
That's
so
another show.
I just thought that was probably, maybe we ought to just say, you know,
Yeah.
The next
because when you say energy work, and then I'm starting to get a sense of how it all starts and kind of what would prompt somebody to want energy work, and kind of what would happen, or what I would experience and why, and some of that. So I'm starting to connect those dots a little bit. But then when you say modalities and different ways of working, that is confusing, or I don't understand what that is.
Yeah, that's a whole
So,
other show.
so we probably ought to wrap
Yep.
Yeah.
and say, okay, let's call it here, and let me be confused for another week.
Right. And then
then we can talk, and then I may come up with some things, you know, between now and
You may
then
watch some
about
movies.
I might watch another
Watch some
movie.
movie.
or-
Yeah.
I'm probably gonna go back and watch Doctor Strange again, because I kept, you know, thinking. In fact, my wife Cheryl said, you know, does this make you think about Karen? And I said, yeah, it actually does. I was thinking about that. So Karen and Kat, you know, and the whole thing that you're doing there. And so I thought, well, okay. maybe there's something here. So it was interesting. Obviously there's some, you know, like with any movie or any dramatization or anything like that, you know, where you take a concept, but I'd just be curious. But anyway, so not just on the movie, but there's just, if there are things in the next week that come up, but right now where I'm at today was, okay, let's talk about modalities or whatever. Number one, what does that mean? And then, you know, I don't need to know that right now because we'll save that for the next one. But
yeah, that could take up an entire show on its own.
Yep.
yeah, so I want to kind of understand when you say modalities, what that means. I assume it's different techniques or whatever.
Right, different techniques.
But what are they and why and how do you, I mean, there's just a whole lot of questions I have around that. Why would you? And I know you've been trained on multiple techniques or modalities,
Yes.
right? So, and you have modalities you're learning or things that you're learning to do.
Always learning.
And so what is that and that kind of thing? So maybe we ought to pause it here, if you will, and
Tune in next week to find out about modalities
exactly.
and how energy is affected in multiple ways.
awesome. Well,
Yeah.
thanks.
Thank you.
Thank
And for
you.
everybody that watches afterwards or after the fact,
Yep.
that would be awesome
Don't forget to post your questions.
Yeah.
Yes, post your questions, please.
Yeah, I might have the same
Absolutely.
ones. Don't steal any of mine. Don't steal mine.
All right, bye.
Bye.